So I want to start this with a little bit of a thought experiment. And I want to do this because, not only are we in a really interesting period of change right now in the healthcare system from a political standpoint, but even more importantly, I think from a business standpoint, where we see tremendous amounts of consolidation, pressures from all over, employers asking for different things. So I'm going to give you $25 billion, and you're welcome. And we can talk about another $5, but I'm going to make you sweat for it. And I'm going to ask you, how would you, if you were coming in, you step in from the cold into the land that we see now, you get to build a healthcare company from scratch, and you can do anything you want. If you want to set up a biopharmaceutical venture capital firm and then go sit on the beach while the returns roll in, that's fine. If you want to build hospitals but how would you use that money if you were starting from scratch right now, building a company that would be profitable and take care of people? What does that look like? What are the components of that?
Well, Drew, that's a great first question. Okay, and look, we're going to get into a lot of things that we're doing at CVS Health, as a new company with, CVS and Aetna coming together. It's going to be a year later this month. But, directly to your question, and I know this is going to sound a little cliche, that, as you think about our communities all across the country, and as you think about healthcare, there are many that, describe your zip code as being, equally, if not more important than your genetic code, and, just access to, fresh foods.
Why is that? Yeah, walk us through why that is.
Look, you think about the challenges that exist in terms of, healthy eating behaviors and, access to fresh foods, access to transportation, housing, and those elements, have been proven to have impacts on one's health. And so how we could invest in some of those elements to make those social determinants, better for our country, I think it would be my first response to that, recognizing that as a company, we're doing a lot of things in that area, as well as other things to help people on their path to better health. But there's so much more that needs to be done that I don't know that one company can do by itself.
Is there a structure, though, for the healthcare system? And this is a leading question because you all have made some very meaningful strategic shifts in your business over the year. You have an insurer attached to you now, in addition to almost 10,000 brick and mortar pharmacies, as well as a pharmacy benefits manager, all kind of housed under the same roof. And I have a feeling that that is probably your answer to my question. But what are the other components of that if you were starting from scratch? And would you have every single piece of that there? Or are there things there that you feel like need to be integrated in a meaningful healthcare system to provide the best possible care to deal with some of those social determinants that you talk about?
Well, Drew, I will say that the assets that we have assembled as CVS Health, there's a lot that we can do that has not been done in the healthcare space. And, as we look at, the challenges associated with healthcare today, we would say that there's three imperatives that are part of our overarching strategy. The need to make healthcare local, meet people where they are, whether it's in their community, in the home, or for many of us, the palm of our hand now. Our healthcare system has become way too complicated. Many describe it as a maze of complexity, and there is an opportunity to make the system simpler and easier to use and navigate. That's one of our imperatives. And then our North Star is helping people achieve their best health, and in doing so, reduce overall healthcare costs. As you look at the growing incidence of chronic disease today, 2/3 of our country has one or more chronic diseases. We know their names: diabetes, hypertension, cardiovascular, asthma, and that list goes on. And you can pick up a variety of studies. Chronic disease accounts for 70 to 80% of all healthcare costs, and yet people are not following the care plans that would help them achieve their best health. We're sitting here saying we can close that gap in this new business model.
So how do you all do that? Because those are problems that I think, I've been covering the healthcare space for 15 years. I was on Capitol Hill when everyone was debating Obamacare, and kind of heard a lot of those same things as concerns, issues with chronic disease, making sure people are getting care. Where are you positioned in order to address those things that other people are not?
Well, Drew, 2 points around that, and some of this gets back to the fact that we are in 10,000 communities all across the country. Today, about 70% of the U.S. population lives within 3 miles, of a CVS. So we're a trusted brand. The role of the nurse practitioner or the pharmacist is, a very trusted professional that knows their customers, know their families. And as you think about the role of the insurer, there's a tremendous amount of information that is resonant about the members that they're serving. And let's describe it as what is the next best health action for each of those individuals. And, you're in good shape from a health perspective. Your next best action may be something preventive in nature. I have chronic disease. My next best action may be I'm not taking my medication, as prescribed by the physician. I need to do something different. But the insurer doesn't have a good way to create engagement with those consumers of healthcare. So you think about the combination of Aetna with all of that information and the legacy CVS business, all of those community assets, you start bringing that together, we can engage, consumers around their health. We can do that as part of their regular routines. And in doing that with the right products and services, we can improve, help someone on their path to better health, improve their health outcome. And when we do that, we know we're going to reduce overall healthcare costs.
So I want to ask you a question that's going to seem like a retail question, but is actually going to be a healthcare question when we come back around it. And I need people to, this is the only time I'm going to ask you to look at your phones while we're talking here, which otherwise I would consider very, very rude. But please go to TYA2019.app, which I'm sure many of you have already done. And we're going to put up a polling question here that you should be able to see on your phones very shortly. I'll let everybody go to find that. Now, I want to, again, I'm going to ask everybody to do the same thing that I just asked you to do, and we're going to imagine that is the end of your day. You've been here at this wonderful conference. You've tweeted about it. It's been very exciting. You've learned a whole lot, and you realize that you were about to run out of paper towels or some beauty product or soap or something like that, and you are about to head home. And so my question to you all that hopefully we'll have up the results on the poll coming up here soon is, what do you do? Do you say, all right, I'm going to swing by on my home and go to the CVS? Hopefully, I know you're going to be rooting for that one. Do I order it on Amazon while I'm sitting here waiting? Or do I wait until the weekend when I can afford to drive out to the Costco or Target or something like that and buy supplies? So I think we'll see. We're starting to see these come in here. So this is, I think, very good news for you all.
Actually, more extra bucks for everybody that voted on that top bar.
One of the very long. This is you guys actually look. This is the receipt length right here that we'll be getting. So, but I do want. Here's where this is going to turn into a healthcare question, because in the conversation that we were just having leading up to this, one of the things that you mentioned the footprint of stores that you all have, and I want you to talk to me about how you all see those in a world where, that middle column is in fact beginning to get bigger and bigger, just as we're kind of seeing folks actually vote in this. Now this is, I'm sorry, gosh. This feels like a real-time demonstration of the last 10 years for anybody who works in retail. What are the stores useful for in the future? And I ask this because we've now seen one of your competitors say, hey, we need to potentially consider a buyout and buy us time to make this transition. You all have gone a very different route. You mentioned that you're in these locations all around the communities. So talk to me about what the footprint of the store is in the future. Do you have too many of them? And how does it need to change given the demands and given the strategic priorities you all have as a business?
Yeah, Drew, great question. And I would say there's two important points that I answer. First is, we're leading the evolution, of tomorrow's drugstore. And you can go back in time, and there's a lot of young folks around, but you can go back decades ago, and as you thought about the corner drugstore, there was a soda fountain in it, okay? And fast food changed that dynamic. Today's drugstore is largely focused around convenience. And tomorrow's drugstore, which again, we believe we're leading the evolution of, is more of a health destination. And yes, it's going to continue to sell those front store products of health, beauty, personal care, and some elements of convenience, but there are going to be more health-related services in those stores beyond just the role of the pharmacy. So we're piloting that. Our first stores are in Houston. The customer response to it has been terrific. I think a lot of folks here are familiar with our Minute Clinics. Well, we have an expanded version of Minute Clinic. It's staffed by a nurse practitioner. That nurse practitioner can treat about 80% of what a primary care can treat. We have in-clinic phlebotomy, but we also have other related services within that store that can help folks understand how to access, how to use the benefits of their insure, or things that are focused on wellness, or things focused on diet, nutrition, exercise. And some of this is all about making healthcare local. So that's my first point. And by the way, the feedback has been so terrific. We're beginning to roll that out in other markets. We're going to be in Philly, Tampa, Atlanta by the end of this year. And we announced a plan for 1,500 of those hubs across the country by the end of 2021. Second point is we're also working to define what omni-channel means for our customers. So it's not just about bricks and mortar. You can pick up your prescription today in many of our stores through the drive-through, but we can deliver it to your mailbox. And what has been growing for us is delivering it to your home or office. And you probably saw the announcement earlier this week in a partnership with UPS to your driveway through a drone. And we announced our retail team has done a terrific job. We announced a subscription service last quarter. In less than 2 months, we have 1 million of our customers that have signed up for CarePass. So, Drew, I would say that innovation has become part of our DNA at CVS Health, and our goal is make sure we're not leaving any white space for disruption by others.
I want to talk to you a little bit about the store footprint, because I'm really curious to understand how when you walk into a drugstore, exactly how you break down how the space is used, because I imagine that that's something that you probably do. And thinking through how exactly that space gets used. I know you all got out of the selling tobacco business, and that's a little chunk of space out of the store that goes to something else. You're now opening up these health hubs, and so something has to be removed from that in order to make room for those. Walk me through, as I imagine we're walking through a drugstore together, tell me where things are going to be coming out of the store in the future as you transition to these new models, and where they're going to be going into the store in a little bit more detail. Because I think that understanding how the retail landscape is changing, and I say this, knowing I know you guys were up 0.6% in front of the store, which is a heck of a lot better than a lot of your competitors have done, I believe, according to your quarterlies. So, I mean, it's clearly you all have figured out something that seems to be going in the other direction on the retail footprint. But walk me through that, what that mix looks like, and how that is changing as you make these plans, even at a more granular level.
Yeah, Drew, I'm going to oversimplify it because we got about 7 minutes left. I could take all 7 minutes and still not answer that question. But there's a lot of technology and analytics that support the decision-making process. But as I mentioned earlier, we want to make sure that we have a broad selection of health, beauty, personal care. That's our first priority. And in listening to our customers, how they define convenience. What is it that meets their needs? So, an example, greeting cards will continue to play an important role as part of the convenience aspect of our stores. But,
as someone who has rushed home and realized that they have not bought a card for their spouse before, you can continue to count on me.
We're trying to keep you out of trouble with that.
I appreciate that
as well. So, there's a lot of science that goes into that, and again, in listening to our customers, that also helps direct us in terms of what continues to be important and relevant for them. But, again, our retail team really did a terrific job of, really understanding, because what you'd see in Houston is we've reduced about 20% of the space in that front store for products and have added services. And ironically, our front store sales are, increasing in that store beyond the control group.
I want to put up another question on the screen here so folks can go back to the TYA 2019.app thing. And this is going to be actually a very similar question, but I want to use it to talk about a different area of online competition. Specifically, now I want you to reimagine another scenario, and I'm sorry to tell you that you all have sinus infections now. It's not our fault. You got these yesterday at some other conference that wasn't as good. But you've been prescribed by your doctor, and you're going to go, and the doctor's giving you a prescription. And so are you going to go home, are you going to stop right home from on the way home from the doctor, either heading back to your office or on your way home, and immediately go and fill that prescription? Are you going to use a online service to have it delivered, or CVS to have it delivered? Or are you going to wait until the next day or two to fill that and how it's convenient? Now, we can talk a little bit about why I'm asking this while we wait for some of these results to come in. And I think probably saying sinus infection immediately biased people towards the misery and dealing with this right away. So I find the competition in the pharmacy space to be particularly interesting because we've been dealing with this in a retail area for years, but it seems like the pharmacy competition online is something that's relatively new, and where you all seem to be making a very aggressive effort to kind of make sure you're demonstrating to customers that you are able to serve them in exactly the same types of way that all these other services are. Are there lessons that you all learned from retail competition and seeing the rise of these consumers that you have now applied to the pharmacy space now that we see folks, like the pill packs of the world, like Capsule and everything like that?
Yeah, Drew, and I think some of this gets back to the earlier point that we were talking about in terms of, I would describe retail of the old as, we would segment consumers. You're a bricks and mortar shopper. You're an online shopper. And, today's consumers all of the above. And how do we make sure that, we give you as the consumer the flexibility to define who you want to be, when you want to be, that's most convenient for you. And that led to, adding some of the other services. I think the second point, I'm sure, at the conference there's been discussion around, the use of data. Okay, and I would say that one of the things that we learned is, we believe that the consumer is in charge of their data. And the example that I'll use is a few years ago, we were trying to collect cell phone numbers, and we had marginal success. Our team did a great job in terms of identifying for the consumer, here's why having access to your cell phone number, why that's important. And today we have an extremely large number of consumers who are conducting, I'll say, pharmacy commerce through their mobile device. And as we sit here today, we have 82 million cell phone numbers.
That's quarter of America, more or less?
Well, and but I think it validates the point that you decide who you're going to give your cell phone number to, and I'm sure that everybody in this room doesn't take that that callously in terms of who you're going to give your phone number to. But it also pointed out for us that it's important to convey the use case for that, and if I can make your life simpler, better, it kind of goes back to those three elements around health: local, simple, improve health. Something as simple as a cell phone number helps satisfy those imperatives.
I want to finish this discussion by coming back to kind of where we originally started. That's the construction of the healthcare system and CVS's position within that. We've been in a period where politically we've seen huge amounts of voter frustration with how things are currently built with either their insurer or with drug companies, with how they have to pay per drugs when they do pick them up. And a lot of that seems to be built around the idea that we have a very fragmented healthcare system with different segments of it, each kind of collecting a piece of rent along the way. You all have made your bet on how this looks. I'm curious if you think we are going to live in a system with far more vertical integration in the future, where your competitors are going to do the same sorts of things and look more and more like you or more like Optum, or if there are aspects of that model that you think will survive and should survive in an effort to kind of differentiate and continue to provide very specialized, very complex services.
Well, Drew, that's a great question. And first of all, as you look across the healthcare landscape, there are many, I'll say, sectors of healthcare that, as you look at horizontal, consolidation, a lot of that is now behind us. And, take the retail pharmacy industry, that there's been a tremendous amount of consolidation, over the last couple of decades. And, you've got CVS pharmacy, you've got Walgreens, and, you've got Rite Aid a distant third, and, probably the fourth largest drugstore competitor, has 100 stores. So you sit there and say, the large-scale horizontal consolidation is over. And there are other sectors that you could say the same about. So yes, the vertical consolidation has begun. Your point about there are silos in healthcare today is absolutely true, and I think that that's one of the challenges that we do have. And this unique model that we're building, one of our goals is breaking down those silos across the continuum of care, to improve the consumer experience around healthcare. So, I do believe that we'll see more of that, not less of that.